aplastic anemia is bone marrow failure. Like patients develop kidney failure, if bone marrow develops dysfunction and stops producing blood, that condition is called aplastic anemia. The normal job of bone marrow is to produce blood, which includes red cells, WBCs, and platelets. In patients with aplastic anemia, this capacity of the bone marrow is reduced or stopped. Hence, they do have low hemoglobin, low platelet count, low WBC count. There are several reasons for low platelet count or associated bone marrow failures. Patients can present with one line failure, which includes either low hemoglobin or low platelet count or a combination of 2 or 3 lines reduced in their peripheral blood. This requires bone marrow test, diagnosis by blood investigations, and treatment include injectable therapy by antithymocyte globulin and tablets like cyclosporin. In some patients, bone marrow transplant is the best option of treatment in patients with aplastic anemia. Bone marrow transplant is a curative treatment for aplastic anemia. Patients may require 1 or 2 medicines after the bone marrow transplant. However, it can completely cure this condition.